question that someone posed, and I had as well. When you think about assisted living environments, or maybe nursing homes, what could be done, or even our own homes, what could we do to help improve exposure to light? What do you recommend specifically?
The first thing is very important that we should have a routine, a schedule for all these people. I mean, demented or now it's really with Alzheimer Association, but for all of them that you remember the slides that I talked to you about, the morning light is very, very important, like 10 a.m. to like 12 p.m. This is the best time of the day we can get a light, especially as we live here. Even in the cloudy days, it doesn't matter because you're still getting lights to your eyes. And then it's very, very important for any of these places. We have some activity outside. And this is something a lot of people around the world, they're doing this right now. I mean, I'm sure you hear about like Australian people, they're doing now for kind of like a protocol when they're taking care of their dementia patient. They have activities actually designed to be outside of the facility. And they actually have both physical exercise, or for example, many of us, we've seen in memory care, the people sitting around like they have activity. It's going to be nice if they have this activity in the patio or somewhere outside, because they actually get in the light at the same time they do muscle activity. That's very, very important. Definitely one of the other things that's very important, avoid darkness. And again, if there's any curtain or line in there in the morning, try to, take them up and then just telling them this is the daytime. Telling the patients that, again, especially dementia people, that this is daytime. Again, reminding them about the time, because they forget this thing, this is the night, this is the day. Because if we don't do that, they're only going to be indoors and they're not going to identify that.
Okay, great. Was fortunate to be able to hear Sonia Israeli is that right? Who is an expert, and you cited some of her work about the lack of light in nursing home settings. In particular. It was really interesting. She did a study in Southern California, I think it might have been San Diego, where she went and she measured light levels and found that none of them had adequate light levels for normal circadian rhythms. And it actually really raised my awareness, because as you mentioned it here, I thought, yeah, if we lived here in this room, we would probably all have sleep disorders. You mentioned being outdoors, but of course we don't want people in direct sunlight. So it's really, as you said, being close to light and having awareness of curtains and...
Absolutely.
Have you had experience with the artificial light, what you showed on the screen? How does that work?
It's actually, that's the other protocol that the people can use. First of all, light box is not expensive treatment. They can always have a light box. There's not any contraindication on the people who have a light box, unless if somebody has a very severe bipolar disorder, maybe increase of suicide in some people, but this is going to be very minimal people. There's not any contraindication with the eyes, because a lot of people, they don't do it because they're afraid about macular degeneration and cataract. The study shows that light box therapy doesn't have. Usually the light box has a blue colored light, and the best way it actually works, if there are, again, in a lot of the countries, like again, Scandinavian countries and a lot of other places, they don't have light, they don't have sunlight, they don't live in California. What they do, they actually expose the people to this light box, and the starting is usually 30 minutes, and to start 50 minutes, 30 minutes, and the best way if you wanted to treat them is early morning, not wait till early afternoon, because if you do it later, they're going to be awake, and that way they actually get the light through the retina. When it works, they don't need to look at inside the light box. For example, if you have a demented patient here, or a demented person here eating breakfast, you can actually put the light here, even not directly to their eyes, and they're getting light around their eyes, and then when they're eating breakfast or eating something, they actually have getting enough the light exposure. Some of the places I see, they have a place on the wheelchair, they actually have the light box on, and they can sit on the wheelchair, and the light is coming from this way, and they get exposed to the light. Starting 30 minutes, go off in 45 minutes, and it should be some measurement that, again, when are they actually going to get better, when they're going to fall asleep earlier, and then we go and continue with that. But again, some of the studies definitely help them with agitation, with a lot of the behavioral symptoms as well, because again, the physiology we discussed, it helps with the brain circadian rhythm when they're not able to get outdoor lights. But the other argue here, a lot of people says actually the light box is more effective even than the sunlight as well, which again, in some way is true because you actually expose them with a higher amount of light, usually 2,500 to 10,000 lux of the light when you use the light box.
When you use a light box
Yes.
instead of being in the sun.
Yes, yes. That's why again, there's some people are doing, I know even like in hospitals, some people are doing it. Like for example, I remember that like at Kaiser Hospital, they were doing research about people who get delirious. I always bring it for delirium that if I wanted to bring it to my trainees, that if I want to torture any of you, I can put you in the intensive care unit and then put you on this light in the hospital, close the door, make the beep on, and then leave you for 5 days.
Yeah.
Believe me, that after 5 days, you're going to be completely delirious and confused and agitated. And that's very, very important because of the light in the hospitals. I mean, all of our hospitals is horrible because majority of the light, I mean, they're usually on, noises in the hospital, but they were doing a study too, like intensive care. But it's very interesting because I've seen also a lot of the places, they have a light box that people put the head inside when they're in intensive care, and that helps that the brain circadian waves come back and they actually get rid of the delirium. One of the major things in delirium in the hospital is actually lack of exposure to the real light and then losing the brain circadian wave.